So we're going to start our conversation in the unit 4 with the different types of infection. And kind of I'm going to group them not exactly as they are located in the lecture notes. Does that make sense? So, first, we have body sites that are sterile and non-sterile. Does that make sense? So we've got sterile body sites. I'm not going to list them, at least on the board, but you should know them. How? So you've got sterile and you've got non-sterile body sites. Non-sterile body sites, I'm going to say, it's kind of obvious. So you've got skin, eyes, ears, external ears, all the way to, well, yeah, pretty much to middle ear, okay? Digestive tract as a whole, okay? Upper respiratory, that's important, it's upper respiratory tract. Your lungs are considered to be sterile. I'll explain what is the difference between, stuff that temporarily gets in and not. Reproductive mucosa. I am very pedantic about this. Not urinary tract. Your urinary tract is sterile except for a small patch at the urethral orifice, very, very close to the urethral orifice. That makes, like, if you go into urinary bladder, it is sterile. If it's not, we're in deep trouble. Okay, everything else is sterile. Like everything except this, we consider it sterile. Now, here are some terms that I'm going to throw at you. So, what do we call when something like microorganisms that are at non-sterile sites? Resident microorganisms, okay? For instance, you have resident staphylococci in your nose, you have resident streptococci in your mouth, resident lactobacilli in a vaginal microbiome, and so on and so forth. Does that make sense?
So it's non-sterile microorganisms at a sterile site?
At non-sterile sites, you have resident microorganisms.
Oh, okay.
Which means they normally, I'm color coding.
Yes, okay.
So they trying to feed as much as I can. So at non-sterile site, I get resident, okay? Now, can you inhale a fungus or a bacteria into your lungs? Absolutely. Will they reside there? No. So at sterile sites, you can have transient. Okay? Don't get me wrong, you can get transient at non-sterile too. So for instance, look, you get I don't know, you go to India, okay? It's very different microbial population in the food. Eat local food, your microbiome changes, okay, temporarily, because there are some transient microorganisms that enter your digestive system. Does that make sense? So the difference between resident and transient microorganisms do not establish a permanent population there. Eventually they will be getting rid of. Does that make sense? Is that clear? Now, let's talk about microbiomes for a bit. Microbiomes is absolutely fascinating concept, but I want to highlight few overarching ideas about microbiomes. We're not going to talk about their role in like Alzheimer's and autism, which is very, very interesting. So microbiomes at different body sites are different. I mean, it's kind of a duh. So microbiome of a skin is different from microbiome of vagina. Does that make sense? Among people, microbiomes at the same sites are similar. So microbiomes, our oral microbiomes, everybody in this room, they will be very similar in terms of the composition. Does that make sense? Microbiomes shape immune response. We know that. And metabolism. Microbiomes, bless you, are altered in disease, and microbiomes of C-section versus birth canal infants are different. So basically, your first microorganisms are acquired when you are being born, and if you going through like the birth canal pathway, it's one set of microorganisms. If you go through C-section, it's a different set of microorganisms. Does that make sense? Now, microorganisms can be further classified by the type of infection. Well, it's not really. There are many types of infection. Okay, type of disease, maybe severity of the disease. So microorganisms can be primary pathogens. Okay, primary pathogen almost always causes the disease. And then you have opportunistic pathogens. These ones cause disease in immunocompromised patients. Does that make sense? Good? We clear? This is immunocompromised. So, for example, let's say Yersinia pestis, which is the causative agent of plague, a pretty good chance you're going to get a disease. Okay, Salmonella is a primary pathogen as well. Now, E. coli, can it cause the disease? Yes. Will it? In a healthy person, very likely? Maybe not. Okay? Does that make sense? So, I will ask you questions like, I'll give you a description of a microorganism. So, for instance, Staphylococcus aureus can be found in the upper respiratory tract of asymptomatic individuals, but can cause disease in immunocompromised people. So you think, okay, can be normally found resident, okay, normally found in the upper respiratory tract, so resident, but can cause disease in immunocompromised, resident opportunistic. Does that make sense? Okay, got this. Other types of Infection. Well, let's define what infection is. Infection always is the replication of the pathogen. No exceptions. Okay? Infection can be symptomatic, or asymptomatic. Good example for this, we know that people with coronavirus infection may have no symptoms and still get infection. Does that make sense to you? Now let's talk about where you get it from. Okay. I know how we're going to classify it. I'm trying a new approach. So, source of infection. So where can you get the infection from? You can get it from the community. Sorry, not this. I'm just misspelling. So community acquired. Does it make sense? You can get it from an animal. In this case, it's a zoonotic infection. Can the same infection be, like the same pathogen, be zoonotic and community acquired? Example is coronavirus. There were multiple introductions of coronavirus into a population which were zoonotic transmissions, and then the virus has become a community acquired disease. Does that make sense? The source can be in the hospital. In the hospital there are two terms for this: nosocomial and iatrogenic. So what's the difference? Nosocomial infection, you go to the hospital for whatever reason and acquire infection there. Does that make sense? Say you go there for surgery, but while staying there, accidentally acquire UTI or some respiratory infection. Not because of the surgery, just because of being in a hospital. Now, you go into the surgery and due to some mistakes during the procedure, you get the infection like of a surgical site, iatrogenic infection. You get a transplantation of an organ that carries latent cytomegalovirus, and you develop cytomegalovirus infection. That's iatrogenic. Iatrogenic is the result of a medical procedure. Does that make sense to you all? Okay, awesome. Timing. Timing of infection. Really simple. You can get a primary infection and a secondary infection. So usually the relationships between primary and secondary infection is that secondary infection is the indirect result of a primary infection. Does that make sense? We see it now in pandemic all the time. People who end up in the hospital with severe coronavirus infection, they often develop secondary infection with bacteria like staphylococcal pneumonia. They develop it because is that secondary infection nosocomial? Or absolutely, yes. It's hospital-acquired nosocomial pneumonia, but people acquire because they are in the hospital and they are immunocompromised and in bad shape due to the primary coronavirus infection. Does that make sense? Okay, finally, I don't know how to say, but like manifestation maybe? So let's call it manifestation of infection. So we've got several types, and that's going to be an interesting conversation now. So we have acute infection, short term. There are symptoms, and the pathogen actively replicates. Okay, does that make sense? Now, immediately, I catch myself thinking, okay, how we are supposed to talk about asymptomatic in this context? In asymptomatic infection, do you have replication? Yes. Do you have symptoms? No. Well, turns out, usually, so when we talk about symptomatic versus asymptomatic, we usually refer to this short-term acute type of infection. That makes sense? Now, there is a chronic infection. So chronic infections, long-term, also with symptoms and replication of the pathogen. So an example of chronic infection can be tuberculosis. Okay, chronic tuberculosis can be hepatitis C. Okay. Now the next term will be familiar to you because we talked about it before. This is going to be latent. So again, this is the long-term condition. No symptoms and no replication. Remember our conversation about herpes viruses, how they stay dormant. So if I tell you, CMV infects the cells, lies dormant, you can't detect virus, there are no symptoms, this is a latent form. Am I clear? However, using that same CMV as an example, what else can it do? Check this out. It can cause what's called persistent infection. So in persistent infection, it's also a long-term process. No symptoms, but there's active replication. It's actually a puzzling phenomenon. We know pretty well that children who are infected with CMV, they may develop persistent infection that lasts for months. They will shed substantial amounts of virus in the urine, showing absolutely no symptoms and no pathology whatsoever. Does that make sense? Same story for the virus called BK virus. Okay, it's virus that sits in kidneys, and in pregnant women we can clearly see persistent infection with that virus. No symptoms whatsoever at all. Does that make sense? Just trying. Okay, yeah. Oh, location. That's the last bit for infection. So we're going to talk about portals of entry and portals of exit. I'm going to mention it very briefly, but based on the infection location, we can distinguish between localized infection, focal infection, and systemic infection. So in systemic infection, you have multiple organs involved. So basically the entire body. Okay? Now, let me ask you this. How microorganisms spread throughout the body? Where do they have to get? In the bloodstream. When a microorganism is in the bloodstream, we refer to it as, if it's a virus, viremia. If it's a bacteria, it's bacteremia. If it's a fungus, fungemia. Does that make sense? So, microbe name, emia. Now, the very specific term Septicemia, it's in the notes. Septicemia usually refers to active replication of a microorganism, especially bacteria, in the blood. Does that make sense? Let me explain the difference. I hope everybody brushed their teeth this morning. When you brush your teeth, you have detectable bacteremia of oral microorganisms. You can take a blood sample and you can detect the oral microorganisms in the blood. That makes sense? Is that bad? Well, your gums are kind of permeable, so is that bad? No, it's not. It's okay. They don't replicate in the blood. They just there. Does it make sense? When somebody are in a state of sepsis, they are in a state of sepsis because microorganisms, especially bacteria, actively replicate in the blood. Okay? Now what is focal infection? One specific organ. So for instance, when Staphylococcus aureus, that originally caused sinusitis, ends up in the heart, causing just that endocarditis. That's focal endocarditis. So what's the difference between focal and localized? Localized infection occurs at the portal of entry. Okay? We're good so far? Now, let me specify something. I'm actually going to mention portals of entry right now, and then we're going to kind of wrap up this conversation. Different microorganisms use different portals of entry. There are many of them. I'm not going to list them. They pretty well listed in the notes. Like skin, blood, digestive tract, respiratory tract, urinary tract, reproductive tract. All those are portals of entry. Does it make sense? Same way of portals of exit. When we cough or sneeze, a portal of exit is respiratory tract. When we vomit or we have diarrhea, it's digestive tract. When blood is taken, blood is portal of exit. Am I clear? So you don't need to memorize the examples that I have in the lecture notes. What I want you to appreciate, if there is no portal of exit, there is no transmission. We're going to talk about it in a minute. Okay? Different microorganisms utilize different portals of entry. Few examples. And depending on this, you can have different infections. Check this out. Coronavirus. What is portal of entry for coronavirus? Respiratory system. What if you will take like a little pill that contains coronavirus and swallow it? It's probably not going to happen. Nothing's going to happen, most likely, because its evolution did not lead to the capacity to reproduce in the digestive tract. Does that make sense? You can spill it on your skin and you're going to be just fine. You see what I'm saying? You can kind of swallow rabies virus and it's going to be absolutely crushed in the stomach. But God forbid letting it into the bloodstream, because then you're screwed. So not only like they have to use certain portal of entry. Look at, say, let's take Proteus mirabilis. You get it into the digestive system, you get diarrhea. You get it in the urinary tract, you get a UTI. You get into the wound, you get wound infection. Different portals of entry often result in different symptoms and signs. Are we clear? Okay.